the explosion, yes, of the oral cavity. When the physician has to open to show the oral cavity, he'll see what? More lips, teeth or gingivas, then the tongue, it should be pulled down, plate, and back part of it soft plate. Yes, and the soft plate, it has the vellum, like an apron, the vellum, palatine, which is finished with uvula, The lateral structures of soft palate are arches, arcus. Everything is formed. The soft palate is formed by, it is the fold of mucous coat, soft palate, it is the fold of mucous coat. Inferior wall of soft palate is formed by mucous coat of oral cavity. The upper and back surface of soft palate is formed by mucous coat of nasal cavity. Between them, muscles and aponeurosis lie. Which muscles lie in soft palate? They are shown in the lower images. All muscles are paired, and two muscles of soft palate, they lie in arches, which surround fauces, which form the lateral walls of fauces. Arches are called as muscles, which lie inside them. You see here arcus palatogluteus, yes, the front arch, which is formed by mucous coat, and the muscle with the same name, musculus palatoglossus. I have told you that in some textbooks it is devoted to muscles of tongue. It is also devoted to the muscles of tongue with skeletal muscles. But because for its development, it is the muscle of soft palate. It is innervated by 10th cranial nerve. Muscles of tongue are innervated by 12, by hypoglossal nerve. So, back to the arch, there should be arcus palatopharyngeus, back to it. Between two arches, there is the fossa tonsillaris, which is filled with tonsil, tonsilla palatina. It lies in the lateral walls of fauces. It is, as tonsilla lingualis, it is formed with lymphoid tissue. It is devoted to peripheral organs of immune system. Yes? Do you know the inflammation of tonsils, tonsillopalatina, is called as, я не знаю, у нас называется ангина, angina, не знаю how it is in English. The inflammation of tonsils. So in fauces.
Inflammation here?
Yes.
In English I don't know, but I know it in Persian. And I had a surgery for inflammation here.
Oh, yes, there may be pion, abscesses. It should be cut. In such cases, it should be cut. So, fauces is the opening in the back wall of oral cavity. The wall as the wall, back wall in oral cavity as the wall is absent. Yes, it is formed by fauces. The fauces connects oral cavity with pharynx, with oral part of pharynx, but it is devoted to oral cavity. It is surrounded above fauces, above. It is formed by soft palate, no vellum palatine. Below, it is formed with the root of the tongue, radix lingualis, and laterally it is formed by arches, palatoglossus and palatopharyngeus. In the walls of fauces, three tonsils are located, three tonsils, lingualis and paired, and two palatine. Inflammation of them, the physician may meet in childhood, yes, because the lymphoid immune system is very active in childhood, and lymphoid structures are very well developed in childhood. And in adult, tonsilla lingualis may be absent, may not be so active. Tonsilla palatina may be, but they are not so active as in childhood and teenagers. So, the tongue If we move the tongue upper, so if we pull the apex of the tongue upper, we'll see the fold which passes from the inferior wall of the tongue till front teeth. It is called as frenulum linguae. Frenulum linguae. Frenulum по-русски это уздечка, like bells on the horse, on the head of the horse. Уздечка, которая help to hold the head of the horse, but here it is called as the frenulum of the tongue. Yes, frenulum of the tongue. Beside it, on the wall, there are caruncula or papilla sublingualis. Caruncula or papilla sublingualis, sublingual gland and submandibular glands, ducts of these glands open on it. And laterally from this caruncula, below tongue, laterally, and to the back passes sublingual fold, bricus sublingualis. It is the position of sublingual gland. Sublingual gland, it has duct which opens on the caruncula and small ducts which open on the fold, sublingual. No, these structures are visible. Here you see the papilla ductuli parotida on the cheek. Yeah, on the cheek. So, this is the upper wall of the oral cavity, hard plate, which is formed by mucous coat, which lays food plate. And you'll see glands, small salivary glands. And the back part of plate is smooth, soft plate, which is formed by mucous coat, muscles, and aponeurosis. Soft plate has 5 pairs of muscles. Musculus palatus glossus, palatus pharyngeus, the line, the same arches. Musculus ovale, which passes to this ovale. Yes, and 2 muscles, musculus levator, which elevate volume, and musculus tensor, which, because for which volume the back part of the soft plate becomes wider. Which is the function of soft plate, of its muscle? It takes part in which? In swallowing. Muscles of soft plate, they take part in swallowing. Because for their contraction, back part of soft plate moves to the back, volume, and stays in pharynx between nasal part of pharynx and the oral part. That is why during swallowing fluid, during drinking or eat food, ball cannot pass upstairs to the nasal cavity. Then muscles which are located in arches, they narrow the fauces, narrow it. Yes, thus not the whole football passes to the pharynx, but only piece of it. So they take part in swallowing. Of course, they take part in articulation, in the formation of sounds too. Not sounds, but in an articulation, in the formation of during speaking, in the formation of specific sounds, like in French. Yes, there's the upper wall. No muscles of soft plate. I show to you here. The bottom, the inferior wall of oral cavity, I show it on the sagittal section, is formed by mylohyoid muscles, not all of them. They form raphe between, and above mylohyoid muscle, musculus geniohyoidus line, and below the ball is supported by anterior belly of the gastric muscle. Yes, так. No, you see here musculus geniohyoidus, and you'll see the submandibular gland, which lies below hyoid muscle. But piece of it, yes, lie above hyoid muscle in oral cavity with sublingual gland. No, and duct, green in color, these are ducts. No, muscles, of mastication, no, tooth, mammal, deciduous tooth, and the permanent tooth, which formation continues after labor till the eruption. So, which tooth, permanent or deciduous, are shown to you here? How many? Then premolars first and second. If you see premolars, so it means that it is permanent teeth. Permanent teeth. And three molars. The last of which, the third, erupts later than till 5 years old, and they not erupt. So then I show you falses and soft palate of the preparate, and here what you should study about tooth, not features of incisors, canines, and so on. At first you should know the parts of the tooth and tissues which form the tooth. Each tooth has 3 parts. They have different shape, size according to their function. Yes, so the size and shape of organ depends on their function. Our tooth, different tooth or different teeth have different functions. So this is molar, of course. It has, how is this part called? Corona, crown. Then neck, the narrowest part, the neck, and roots, or root, which are located inside alveoles in the part of it, yes, and which are separated intra-alveolar septums. So hard tissue. So this light brown in color, it is dentine. It contains numerous small channels which connect cavity with the external surface. Then crown dentin is covered by enamel, and in crown, in radix, the dentin is covered by cementum. Yes, pink in color. I think that it is white in color, cementum.
Yes, white.
And pink in color, it is periodontum. Periodontum, which fixes the roots of the tooth, of any tooth, to the poles of alveoles. No, and different. It is the front view of different teeth. Different teeth. They have different shape. Front view, front view. You'll see that incisors, the shape of their crown from front view looks like it is trapezius in shape, trapezoid in shape. Yes, it is the occlusal or incisal edge. Then canine and premolars, the front view of them have the same shape as they are pentagonal in shape. Pentagonal with 5 angles. Yes? 1, 2, 3, 4, 5. And the molars, they're quadrangular in shape. From front view, quadrangular in shape. Так. Что еще там надо знать? Ну, да так, да? Так. The papillae are shown to you, papilla violata, papilla fungiformis. These are papilla filiformis. Most of papillas are papilla filiformis. And here, see here, tasty parts. And the muscles of tongue. I don't know which is lower, below. Oh, сейчас. Вон, spaces of the face, of the oral cavity, facial spaces, so they are full asleep, facial spaces. The space between tongue above milhyoid muscle and below the mucous coat is called sublingual space. Or sublingual fatty space. Sublingual fatty space. It is this one. Yes, sublingual fatty space. The space below milhyoid muscle with submandibular gland is submandibular space. Submandibular space. This space connects with submental space. Yes. Inflammation of submandibular may spread to submental and vice versa, from submental to submandibular. The facial space itself connects with which space to the back? With buccal. Yes, buccal space.
Yes.
Then mesenteric, with spaces which are located here.
Pterygopalatine,
да, paropharyngeal, mesenteric, temporal, above. And one more space is between mucous coat of another space is between mucous coat of plate and the bone plate too. Bone developed here in the back, very back part. It is the plate space, and inflammation from upper back teeth spread to the space. But it is enclosed. The plate space is enclosed. Doesn't connect with other spaces. Все.